What if I told you that the blood pressure number your doctor once told you was perfect might not actually be perfect for you anymore, especially if you're over 60? And what if chasing a number that looks good on paper could actually make you feel weaker, dizzy, exhausted, or even increase your risk of falling? Today, we're going to talk about the real truth about blood pressure in older adults. Not the fear-based version, not the oversimplified version. The real, balanced, practical truth that helps you live longer, feel stronger, and protect your brain and heart at the same time. If you're over 50, 60, 70, or you care about someone who is, this conversation could completely change how you think about your health. For years, we've been told that 120/80 is the gold standard, that if you're higher than that, you're in danger. But here's the part nobody talks about. As we age, our bodies change. Our arteries change. Our nervous system changes. Our hydration levels change. Even how our brain regulates blood flow changes. So the question isn't just, is 120/80 good? The real question is, what blood pressure keeps you safe without starving your brain, your muscles, and your organs of the blood they need? Let's start with something important. Blood pressure is not just a random number. It's the force of blood pushing against your artery walls. The top number, systolic, is the pressure when your heart beats. The bottom number, diastolic, is the pressure when your heart relaxes. When you're younger, arteries are flexible and elastic. They expand easily. But as we age, arteries stiffen. That stiffness naturally raises systolic pressure. That means a 70-year-old with a systolic reading of 135 is not the same as a 30-year-old with the same reading. Context matters. Now, here's where things get interesting. In many older adults, aggressively lowering blood pressure can cause dizziness, brain fog, weakness, and falls. Why? Because the brain needs adequate perfusion. If pressure drops too low, especially when standing up, blood doesn't reach the brain quickly enough. That's called orthostatic hypotension. You stand up, you feel lightheaded, maybe your vision dims for a second. That is not just normal aging. That's a signal. At the same time, we can't ignore the other side of the equation. Blood pressure that's consistently too high increases the risk of stroke, heart attack, kidney damage, and cognitive decline. So the goal is balance. Not too high, not too low, stable and supportive. So what's the sweet spot? For many older adults, especially those over 65, a systolic blood pressure somewhere between 120 and 140 can be reasonable depending on the individual. For some people, 130 to 135 may actually feel better and be safer than pushing down to 115, especially if lowering it further causes symptoms. The bottom number, diastolic, is also important. When diastolic drops too low, especially below 60, coronary arteries may not get enough blood during relaxation. That can increase heart strain in some individuals. And here's something very few people talk about: pulse pressure. That's the difference between your systolic and diastolic numbers. For example, if your blood pressure is 150/70, your pulse pressure is 80. A wide pulse pressure can be a sign of arterial stiffness. As we age, pulse pressure often widens. This matters because it tells us more about vascular health than just looking at the top number alone. Now let's talk about how you actually feel, because numbers are important, but symptoms matter too. Do you feel steady when you stand up? Is your energy stable during the day? Is your thinking sharp? Are you sleeping well? Are you experiencing frequent headaches? Do you feel pressure in your chest? The real truth is that optimal blood pressure in older adults is not one universal number. It's a range that supports quality of life, brain function, and cardiovascular protection. Let's address the fear factor. Many older adults panic when they see 138 on the screen. They think, I'm in danger. But blood pressure fluctuates naturally throughout the day. It rises when you're stressed. It rises when you talk. It rises when you move. It rises when you're at the doctor's office. That's called white coat hypertension. Some people have perfectly normal blood pressure at home and elevated readings only in clinical settings. That's why home monitoring can be powerful. When you check your blood pressure at home in a relaxed state, seated comfortably, feet flat on the ground, after resting quietly for 5 minutes, you get a more realistic picture. And consistency matters more than a single reading. One high reading does not define your health. Now let's go deeper. Why does blood pressure tend to rise with age? One reason is endothelial dysfunction. The endothelium is the inner lining of your blood vessels. When it's healthy, it produces nitric oxide, which helps vessels relax and dilate. As we age, nitric oxide production often decreases. Inflammation increases. Oxidative stress increases. Vessels become less flexible. That increases resistance, which increases pressure. Another factor is insulin resistance. Elevated insulin levels stimulate the sympathetic nervous system and promote sodium retention. That raises blood pressure. This is why metabolic health and blood pressure are closely connected. It's not just about salt. It's about blood sugar, inflammation, stress hormones, sleep quality, and movement. Now let's talk about salt, because this topic always comes up. Yes, excessive sodium can raise blood pressure in salt-sensitive individuals. But here's the nuance. Not everyone is equally sensitive, and cutting sodium too aggressively, especially in older adults, can sometimes lead to weakness, dehydration, and electrolyte imbalances. The real key is balance between sodium, potassium, magnesium, and hydration. Potassium is critical because it helps relax blood vessel walls and balance sodium levels. Many older adults don't get enough potassium from whole foods like leafy greens, avocados, squash, and beans. Magnesium also plays a major role in vascular tone and nervous system regulation. Low magnesium can contribute to higher blood pressure and muscle cramps. Let's talk about something even more important: frailty. In very elderly adults, especially those over 80 who are frail, the approach to blood pressure may shift. Studies have shown that in some frail older adults, slightly higher systolic blood pressure may be associated with better survival compared to aggressively lowering it. Why? Because very low blood pressure in frail individuals can increase fall risk and reduce organ perfusion. This doesn't mean high blood pressure is good. It means personalization matters. A healthy, active 68-year-old who strength trains and walks daily is not the same as a 92-year-old who struggles with balance and appetite. The best blood pressure target must match the person. Now let's talk about brain health. High blood pressure over time damages small blood vessels in the brain. That increases risk of vascular dementia and stroke. So protecting the brain absolutely requires controlling chronically elevated pressure. But again, dropping it too low too fast can also cause problems. The brain needs steady flow. If you're watching this and wondering, how do I know what's right for me? Here's a practical way to think about it. First, track your average blood pressure at home for 2 weeks, morning and evening. Write it down, notice patterns. Second, notice symptoms: dizziness, fatigue, brain fog. Third, look at your overall health picture: blood sugar levels, kidney function, medications, hydration status, activity level. Lifestyle plays a massive role here. Walking daily improves endothelial function. Resistance training improves insulin sensitivity. Deep breathing reduces sympathetic nervous system activation. Sleep lowers cortisol. These are not small things. They are powerful regulators of blood pressure. Speaking of stress, chronic stress is one of the most underestimated drivers of elevated blood pressure. When you're constantly in fight or flight mode, adrenaline and cortisol keep vessels constricted. Even if you eat perfectly, unmanaged stress can keep your numbers elevated. Practices like slow breathing, prayer, meditation, spending time in nature, and meaningful social connection are protective. Let's also discuss medication, because many older adults are on one or more blood pressure drugs. Medications can be life-saving. They reduce stroke risk and heart attack risk. But dosages sometimes need adjustment over time. If you're experiencing dizziness, falls, or extreme fatigue, that's a conversation worth having with your doctor. Sometimes less is more. Another factor is hydration. Older adults often have a reduced thirst sensation. Mild dehydration can actually cause blood pressure instability. Drinking adequate fluids consistently throughout the day supports vascular health. There's also the issue of nighttime blood pressure. Healthy blood pressure follows a circadian rhythm. It dips slightly at night. Some individuals are non-dippers, meaning their blood pressure stays elevated at night. That pattern is associated with higher cardiovascular risk. Sleep apnea is a major contributor to this pattern. If you snore loudly, wake up gasping, or feel exhausted despite sleeping, that's worth investigating. Let's talk about the emotional side for a moment. Many people become obsessed with chasing a perfect number. They check their blood pressure multiple times a day and panic over small changes. That anxiety itself can raise readings. Remember, the goal is steady, supported, resilient health, not perfection. So what's the real truth? The best blood pressure for older adults is the lowest pressure that reduces long-term cardiovascular risk without causing symptoms like dizziness, weakness, or falls. For many people over 65, that may mean systolic between 120 and 135. For some, up to 140 may be reasonable depending on overall health and symptoms. Diastolic ideally stays above 60 in most cases to maintain adequate perfusion. And here's something empowering. You have influence over this number through movement, through muscle building, through blood sugar control, through stress reduction, through sleep, through nourishing foods rich in potassium and magnesium, through staying socially engaged, through staying strong. If you take one thing away from this conversation, let it be this. Your blood pressure is not just a number to fear. It's feedback. It's information about how your cardiovascular system is functioning in this season of life. The goal is not to force it into a rigid box. The goal is to support your body so it finds balance naturally, with appropriate medical guidance when needed. Aging does not mean automatic decline. It means adaptation. Your arteries may be stiffer, but they can still function beautifully with the right care. Your heart can remain strong. Your brain can remain sharp. Stability matters more than extremes. And remember, you are not a statistic. You are an individual. Your best blood pressure is the one that keeps you upright, clear-headed, energized, and protected long-term. Keep tracking, keep asking questions, keep strengthening your body, and most importantly, keep pursuing health with wisdom, not fear. When we talk about creating a personalized blood pressure range based on function, not just guidelines, we're shifting the entire conversation away from chasing a universal number and toward understanding how your body actually performs in real life. For decades, people have been handed a target like 120/80 as if it were a one-size-fits-all rule carved in stone. But human beings are not standardized machines. Especially as we age, physiology becomes more individual, more nuanced, and more dependent on context. So instead of asking, what number should I force my blood pressure to be? The better question becomes, at what range does my body function best while still protecting my long-term health? Function means how well you think, how steadily you walk, how strong you feel, how clearly you see when you stand up, how well you sleep, how much energy you have in the afternoon, how stable your mood is, and how resilient you feel under stress. Those are not abstract qualities. They are measurable in daily life. They are deeply connected to circulation, oxygen delivery, nervous system balance, and organ perfusion. Blood pressure is not just a risk marker for heart disease. It is also a real-time indicator of how effectively blood is reaching your brain, kidneys, muscles, and heart itself. As people move into their 60s, 70s, and beyond, arteries naturally lose some elasticity. Collagen content increases, elastin decreases, and the vessel walls become stiffer. This changes how pressure waves move through the arterial system. Systolic pressure often rises, even in otherwise healthy individuals. That doesn't automatically mean something is wrong. It means physiology is evolving. If we try to force systolic pressure into a youthful range without considering symptoms or structural changes, we may unintentionally reduce perfusion to vital organs. The brain is especially sensitive to perfusion changes. Cerebral autoregulation allows the brain to maintain relatively stable blood flow across a range of blood pressures. But in older adults, especially those with long-standing hypertension, the autoregulatory curve may shift. That means their brains may have adapted to slightly higher pressures. If pressure is lowered too aggressively, particularly in a short time frame, cerebral blood flow can drop below optimal levels. The result might not be dramatic at first. It may show up as subtle cognitive slowing, increased fatigue, lightheadedness, or reduced exercise tolerance. This is why function must guide the range. Imagine two individuals who both have a systolic reading of 132. One feels energetic, steady on their feet, mentally sharp, and physically active. The other feels dizzy when standing, complains of afternoon brain fog, and has had 2 recent falls. The same number does not represent the same outcome. The functional context defines whether that pressure is supportive or problematic. Creating a personalized range begins with observation. Consistent home monitoring provides more meaningful insight than isolated clinic readings. Blood pressure fluctuates throughout the day in response to activity, stress, digestion, hydration, and sleep. A single number taken in a stressful environment may reflect temporary sympathetic activation rather than baseline physiology. Tracking morning and evening readings over several weeks reveals patterns. Is there a significant drop upon standing? Is pressure stable during calm periods? Does it spike dramatically under minor stress? Orthostatic response is especially important in older adults. Measuring blood pressure while seated and then again after standing for 1 to 3 minutes can reveal how well the autonomic nervous system compensates. A significant drop in systolic pressure upon standing, especially accompanied by dizziness, suggests that the current range may already be on the lower end of functional tolerance. In that case, pushing numbers even lower could increase fall risk. Falls are not minor events in later life. They can trigger a cascade of consequences, including fractures, hospitalization, loss of independence, and fear of movement. If blood pressure targets contribute to instability, the broader health cost may outweigh theoretical cardiovascular benefit. This does not mean allowing uncontrolled hypertension. It means calibrating treatment to preserve both vascular protection and physical stability. Functional assessment also includes cognitive clarity. Subtle cognitive decline can sometimes correlate with overly aggressive blood pressure reduction in certain individuals. While high blood pressure is clearly associated with long-term risk of stroke and vascular dementia, excessively low diastolic pressure may reduce coronary and cerebral perfusion. Diastolic pressure is particularly important because coronary arteries fill primarily during diastole. If diastolic pressure drops too low, especially below 60 in some individuals, myocardial perfusion may be compromised. Kidney function is another essential component. The kidneys depend on adequate perfusion pressure to filter blood effectively. Chronic hypertension damages delicate glomerular structures over time, but overly rapid or excessive lowering of pressure can also reduce filtration temporarily. Monitoring kidney markers alongside blood pressure trends offers insight into whether the chosen range is supportive or stressful. Functional range also depends on biological age rather than chronological age alone. A highly active 72-year-old who strength trains, walks daily, maintains healthy metabolic markers, and has strong muscle mass may tolerate and benefit from a lower systolic target than a frail 88-year-old with limited mobility and low body weight. Muscle mass itself influences metabolic regulation and vascular health. Resistance training improves insulin sensitivity, enhances endothelial nitric oxide production, and reduces sympathetic overactivity. These adaptations often stabilize blood pressure naturally without forcing it into a narrow numeric target. The autonomic nervous system plays a central role in determining blood pressure variability. Chronic sympathetic dominance, often driven by stress, poor sleep, chronic pain, or inflammation, elevates resting pressure and reduces heart rate variability. Personalized range development must include nervous system regulation strategies, slow diaphragmatic breathing, paced respiration, and consistent sleep schedules can shift autonomic tone toward parasympathetic balance. When sympathetic drive decreases, vessels dilate appropriately and pressure stabilizes without excessive medication burden. Metabolic health cannot be separated from vascular health. Insulin resistance increases sodium retention and stimulates sympathetic activation. Elevated blood sugar damages endothelial cells and promotes inflammation. In individuals with metabolic syndrome or type 2 diabetes, optimizing blood pressure may require addressing glucose regulation, body composition, and physical activity patterns rather than escalating antihypertensive medications alone. As metabolic markers improve, the functional blood pressure range often narrows naturally into a healthier zone. Hydration status is frequently overlooked. Older adults may experience diminished thirst perception. Mild dehydration reduces plasma volume and can produce both higher resting heart rate and orthostatic symptoms. In some cases, fluctuating blood pressure readings reflect inconsistent hydration rather than structural vascular disease. Ensuring adequate fluid intake throughout the day contributes to stability. Electrolyte balance also influences vascular tone. Potassium supports vasodilation and counterbalances sodium's effects. Magnesium plays a role in smooth muscle relaxation and endothelial function. Insufficient intake of these minerals may increase vascular resistance. A personalized blood pressure plan may incorporate dietary patterns rich in leafy greens, legumes, seeds, and whole foods that naturally provide electrolyte balance. Sleep quality profoundly affects blood pressure regulation. During restorative sleep, blood pressure typically dips. Non-dipping patterns, often associated with sleep apnea, increase cardiovascular risk. In individuals with suspected sleep-disordered breathing, addressing airway obstruction may improve nighttime and daytime blood pressure without aggressive pharmacologic intervention. Personalized range creation therefore includes evaluating sleep patterns and symptoms such as snoring, daytime fatigue, or morning headaches. Medication regimens require periodic reassessment. Polypharmacy increases risk of interactions and side effects. As body weight changes, muscle mass improves, or stress decreases, previously appropriate dosages may become excessive. Regular dialogue with healthcare providers allows gradual adjustment based on functional markers rather than rigid adherence to outdated targets. Another important dimension is variability itself. Excessive blood pressure variability has been linked to adverse outcomes. A personalized range prioritizes stability. For example, maintaining readings consistently between 125 and 135 may be more protective than fluctuating between 110 and 160. Lifestyle consistency, routine sleep-wake cycles, and regular physical activity help reduce variability. Emotional well-being influences vascular tone. Chronic anxiety elevates baseline sympathetic output. Fear of high readings can paradoxically increase readings. Creating a personalized range requires psychological reframing. Instead of reacting with alarm to minor elevations, individuals learn to observe trends calmly. Reduced anxiety lowers catecholamine release and contributes to steadier measurements. Inflammation is another underlying driver. Systemic inflammation stiffens arteries and impairs nitric oxide production. Diets high in ultra-processed foods, trans fats, and excessive sugar contribute to inflammatory burden. Conversely, anti-inflammatory dietary patterns rich in phytonutrients, omega-3 fatty acids, and fiber support vascular flexibility. When inflammation decreases, the functional pressure range often shifts downward organically. Physical conditioning influences how the cardiovascular system responds to demand. Aerobic exercise enhances stroke volume and reduces resting heart rate. Improved cardiac efficiency means the heart can pump adequate blood with less pressure. Over time, consistent movement lowers baseline systolic values while maintaining strong perfusion. The goal is not immediate dramatic reduction, but gradual recalibration, supported by adaptation. Balance training and lower body strength also intersect with blood pressure management. Strong leg muscles assist venous return when standing, reducing orthostatic drops. Improved proprioception decreases fall risk even if mild blood pressure fluctuations occur. Functionally, this allows a slightly lower target without compromising safety. Environmental factors matter. Extreme heat can dilate blood vessels and lower pressure abruptly. Illness, dehydration from gastrointestinal upset, or medication timing changes can alter readings. A personalized range accounts for these variables rather than interpreting each deviation as pathology. Genetic factors influence vascular reactivity and salt sensitivity. Some individuals experience pronounced pressure increases with sodium intake, while others show minimal response. Personalized dietary guidance based on observed patterns is more effective than blanket restrictions. Socioeconomic stress, loneliness, and lack of social engagement correlate with higher cardiovascular risk. Social connection reduces stress hormones and supports healthier behaviors. In personalized planning, lifestyle context is inseparable from numeric targets. Creating the range involves iterative adjustment. Suppose an individual averages 142 systolic at baseline with no symptoms. Through dietary shifts, walking, strength training, improved sleep, and stress reduction, average drops to 134 over several months. They feel energetic, steady, cognitively clear. That may represent their optimal functional zone. Attempting to push further down to 118 through additional medication might introduce dizziness or fatigue without proportionate benefit. Conversely, if someone consistently measures 150 with occasional headaches and reduced exercise tolerance, gradual reduction toward the mid-130s could improve both long-term protection and daily comfort. The process is dynamic. It evolves with health status changes. Monitoring should include context notes. Recording how one feels during each reading provides correlation between numbers and experience. Over time, patterns emerge. Perhaps systolic 128 corresponds with peak clarity and stable mood, whereas 115 correlates with sluggishness. These observations inform discussion with healthcare providers. Personalization also means respecting individual goals. Some prioritize aggressive risk reduction due to strong family history of stroke. Others prioritize maintaining independence and minimizing fall risk. Shared decision-making integrates values with evidence. Hormonal influences shift with age. Postmenopausal changes affect vascular reactivity. Reduced estrogen contributes to endothelial dysfunction. Understanding these shifts contextualizes modest increases in systolic readings. Weight distribution matters more than total weight alone. Visceral adiposity correlates with hypertension through inflammatory and hormonal pathways. Reducing central adiposity through resistance training and dietary modulation can narrow pulse pressure and stabilize systolic levels. Breathing mechanics influence intrathoracic pressure and venous return. Shallow chest breathing maintains sympathetic dominance. Slow nasal diaphragmatic breathing stimulates vagal tone, reduces heart rate, and lowers pressure transiently. Practiced consistently, it can recalibrate baseline autonomic balance. Cold exposure and seasonal changes affect vascular tone. Winter months may see slightly higher readings due to vasoconstriction. Recognizing seasonal variation prevents overcorrection. Regular review intervals are essential. A personalized range set 5 years ago may not fit current physiology. Health status evolves. Medication sensitivity may change. Ongoing assessment preserves alignment between numbers and lived experience. Education empowers self-awareness. Understanding the relationship between systolic, diastolic, and pulse pressure enhances interpretation. A widening pulse pressure may signal arterial stiffness, requiring lifestyle intervention, even if systolic alone appears acceptable. Inflammatory markers, lipid profiles, and glucose metrics add layers of insight. Blood pressure does not exist in isolation. Cardiovascular risk emerges from interaction among multiple systems. Ultimately, creating a personalized blood pressure range based on function means shifting from rigid compliance to responsive stewardship. It requires curiosity about how the body responds under different conditions. It honors individuality without dismissing evidence. It balances protection against stroke and heart attack with preservation of cognition, mobility, and vitality. It integrates lifestyle, medication, monitoring, and symptom awareness into a coherent strategy tailored to the person rather than the population average. If you take one thing away from this conversation, let it be this. Your blood pressure is not just a number to fear, it's feedback. It's information about how your cardiovascular system is functioning in this season of life. The goal is not to force it into a rigid box. The goal is to support your body so it finds balance naturally, with appropriate medical guidance when needed. Aging does not mean automatic decline. It means adaptation. Your arteries may be stiffer, but they can still function beautifully with the right care. Your heart can remain strong. Your brain can remain sharp. Stability matters more than extremes. And remember, you are not a statistic. You are an individual. Your best blood pressure is the one that keeps you upright, clear-headed, energized, and protected long-term. Keep tracking, keep asking questions, keep strengthening your body, and most importantly, keep pursuing health with wisdom, not fear.